Good afternoon, everyone. Welcome to Areté's Our Way Forward. Today is the third installment on our discussion on the health system. To help me go over the remaining building blocks are the production team, Mais Bunag, Juancho Cahucom, Chino Cornell, and Trisha Rosella. So let's begin. So this is our third part of the series. And we start by defining again what health is based on the WHO. This is a condition that is not simply the absence of disease, but the totality of a person's physical, intellectual, psychosocial, and spiritual well-being. Health then becomes something an individual or a group will need to realize their aspirations, satisfy their needs, and change or cope with the environment. Clearly, this definition describes health as a resource for everyday life. Therefore, it is not the end goal, but rather a means to higher ends. Using the social determinants of health framework, we should understand that an individual or a population will have all of these resources, these tools, circumstances that they will encounter in their day-to-day life. From here also, they will have their capacities that will allow them to address specific endeavors, but at the same time, how they are going to interact with the rest of society. So we have what we call the structural determinants of health, and these would include the political, economic, and social systems, as well as cultural systems that will define our social norms, including the values that we uphold as a society. These structural determinants will give rise to what we call SEPs, or socio-economic positions. And what are these SEPs? These positions will define the power by which a person or a group will exercise their ability to choose and determine their health outcomes. Socio-economic positions are measured in terms of education, occupation, income, gender, and even ethnicity. However, every society in the world would encounter what we call an unevenness or unequal distribution of this power. And they result into what we call inequities. Inequities in the form of material circumstances, social cohesion, psychosocial factors, behaviors, and even, to some extent, the biological factors that a person is born into. Okay? And these inequities are, in fact, deemed as the pathways, or will be part of the pathways that will translate those structural determinants, those fundamental conditions, to what we eventually will experience as health outcomes and opportunities. Okay? A part or a big component and a significant factor within these intermediaries is what we call the health system or the healthcare system. There are what we call 6 building blocks of a health system. First two are generally the investments, no? Because it means these are blocks that we will have to work on to start off or to build our system, no? And then you have your medical products, vaccines, and technologies, as well as your service delivery. These are your showcases, no? Or the showrooms for which the health system will be felt by the people. And then finally, you have 2 more blocks, governance and leadership on one hand, and information systems on the other hand. These two blocks cut across all the building blocks because of their relative influence in terms of how the entire system is manifested and is run throughout the other building blocks. When we discuss the health system, it's important to appreciate how this system is accessed by the people, what particular services and needs will be covered by the system. Is it of a certain quality? Is the system providing excellent service and high quality products that are going to benefit the population? And then, of course, lastly, safety. Are we ensuring that your health professionals will provide safety services as well as safe products for the improvement of the health of the people? All right, let's begin with the building blocks. Let's start with the health workforce, and I'd like to ask Juanjo to discuss this, please.
Thank you, Doc. So the health workforce refers to the human resources for health, which the WHO defines as all people who are engaged in actions or activities whose primary intent is to enhance health. So this workforce therefore includes not just your doctors, but also nurses, midwives, barangay health workers, hospital managers, pharmacists, and many more. So for a health system to function properly, you need to have enough people with sufficient training and expertise. Unfortunately, the COVID-19 pandemic has caused a shortage in the health workforce, especially because of the need to quarantine health workers who have been exposed to the virus. This is worse for the provinces and rural areas, which were already experiencing a shortage of health workers even before the pandemic hit. So as discussed in episode 1, there is a challenge to balance the production and retention of health workers because doctors and nurses have been migrating away from the country. One of our Doctors to the Barrios guests shared that this could be due to the lack of incentivization of working in rural areas and public institutions. So a notable example from that episode was the presence of salary caps in the budgets of LGUs that limit the amount of funds that can be allocated for health worker salaries, further discouraging the influx of health workers and lowering their morale. Another issue would be education and training. So as mentioned by the DTTP guests, there are usually just 1 to 2 doctors for the whole municipality, which is why nurses and midwives have taken other functions and responsibilities. So to ensure a well-performing workforce, we therefore need to incentivize the retention of health workers in areas and fields where we need them most, and we need to formalize and strengthen training so that we can develop the responsibilities of our non-physician health workers as well.
Okay, thank you. So let's talk about health financing. Tricia?
Yes, Doc. So financing, like everything else, is vital to the sustainability of the health system. So without funds, we cannot pay our health workers, we cannot build infrastructure, we cannot buy our medicines and vaccines. So while health financing is primarily involved with raising funds for health, it is also concerned with proper allocation and ensuring access to these services while reducing the likelihood of catastrophic health expenditures. So currently, we have PhilHealth that provides assistance to patients through social pooling and no balance billing, both of which are aimed to reduce out-of-pocket payments. However, health systems are very expensive, and a sustainable source of funding is needed because many Filipinos rely on PhilHealth. So the UHC law signed by the president just last year is a good starting point, but its implementation, which is still being debated about right now, is going to be challenging, especially given the context that we have right now. The provisions include expanding PhilHealth membership to all Filipinos and also channeling funds from government sources such as PAGCOR and PCSO into PhilHealth. So funding will be much more difficult now with COVID, and it's really bound to get more challenging, especially due to the increased hospital costs And also there will be a lot more people relying on PhilHealth due to loss of work because of the prolonged quarantine. And also, we also see stories from our health workers who need to be compensated for the increased workload and also the increased exposure to risk. And obviously, to maintain morale, which is what we also discussed in the episode one. So, as we move forward towards a better health system, we must first ensure that our health financing system is able to raise and equitably allocate funds for health while providing financial risk protection to people who access the health services.
Thank you, Trisha. So we go to the next. Chino?
Yes. So a key input into a well-functioning health system includes adequate facilities, equipment, and supplies. So this could be in the form of hospitals, health centers, vaccines, and other consumables like medicines. This, however, may not be the case for a lot of countries, which pushes health leaders to develop logical and evidence-based systems that would allow them to work around the economic barriers they face. So some of the most pressing concerns in the medicine and technology building block would include the uneven distribution of resources favoring urban centers, high R&D costs, patent issues, consumer bias towards branded items, and technologies that are developed without really consulting the end users. So as discussed in episode 2, a prime example of this would be donated PPEs. Although they were highly appreciated and welcomed during this COVID-19 pandemic, there were unintended consequences that need to be taken into account, such as the possibility of reliance on donated PPEs in the future, and also a lack of quality control in creating these makeshift PPEs. So moving forward, well, the universal healthcare ideally aims to address some of these concerns through one, pooling and management of all resources intended for health into a special health fund, and two, push to utilize health technology assessment or HTA. So first, pooling of province-wide and city-wide resources allows for the single purchaser to drive down total cost of goods following simple economics of scale. This would allow the health system to purchase and utilize more resources for the same cost, leaving excess resources to be reallocated for more pressing health concerns. Secondly, the use of HTA, which is a multidisciplinary and multi-sectoral approach to systematically evaluating health technologies and medicines. So this would allow the health system to prioritize acquisition of these health technologies that would be deemed most cost-effective, highly impactful, and socioculturally appropriate. This will give more assurance that there's optimal value for the pesos spent on health. Similar to the human-centered design approach, it involves consideration of the human perspective in all the steps in creating solutions for problems. This highlights the fact that these supplies and equipment are, at the end of the day, only a means to an end, the end goal being its utilization to improve quality of health of people and not simply developing the best product on paper. Moving forward, a well-functioning health system ensures equitable access to essential products, vaccines, and technologies of assured quality, safety, efficacy, along with their scientifically sound and cost-effective use.
Okay, thank you. All right, so we move on to service delivery. Mais?
Okay, so providing healthcare services does not only focus on the disease itself, but rather on the needs and expectations of the people throughout their lives. These services are not only limited to treatment and disease management, they also include health promotion, disease prevention, as well as rehabilitation and palliative care services. So some of the issues in service delivery include the inequalities in the type and availability of infrastructures and equipment in many places, especially in the geographically isolated and disadvantaged areas. Often the emphasis is on the lack of infrastructure rather than on the possibilities of providing quality care despite that lack. The question of accessibility is often reduced to being a question of geography. But as seen in the COVID pandemic, primary care services were compromised, making them inaccessible to certain people. As shared by our Doctors to the Barrios in episode 1, services are now more focused on COVID. And because of this, essential services like vaccinations, antenatal care, and prenatal checkups have been neglected. In relation to this, hospitals have been overcrowded and overwhelmed because of the COVID cases. But at the same time, there are still other patients who would require other services. Because of this, healthcare in the community setting needs to be strengthened so that service delivery can be distributed. In this way, the needs of more people and the whole community can be catered to. Moving forward, a good health system provides people-centered care with integrated health services that deliver effective, safe, quality interventions to those that need them when and where needed with minimum waste of resources.
Moving on, we have to look into the health information system. And this could be, the information system plays a very fundamental and crucial role in terms of improved services by providing us with the right information that will be utilized to analyze and produce interventions that are going to be not only evidence-based, but also sensitive to the culture of the people who are availing of the services. It's important to make this information available for not only for the decision makers, but for the general public as well, so that they themselves can make their own decisions as to how they can keep themselves healthy. It's important also that research will help standardize not only the treatments, but also the tools and the other methods of data collection. And hopefully we can build a database that can help in terms of integrating all of this information in other areas and services to produce maximum effect. Clearly, to put up such a system, we need to collaborate at all levels, from the local to the regional and up to the national levels of governance, in order to make, not only to share the data, but also to look to come up with approaches that can address priority data gaps. Now, it's important, as I've said, to make the gaps in information, or to address the gaps in information, because clearly, if we don't have information, we will have no rational basis for our decisions. And we, as a culture, will have to look at the best way at how we can keep our records. It's not as simple as digitizing information. It is fundamentally a system by which we collect, organize, share, analyze, and utilize eventually this information. To move forward then, a well-functioning health information system is one that ensures the production, analysis, dissemination, and use of reliable and timely information on health determinants, health system performance, and eventually health status. Now, many have been said about leadership and governance. In fact, in the first and even in the second episode, we were talking about how that leadership will direct and motivate many, or the rest of the workforce, but at the same time that this leadership and governance can ensure the quality of the services that we provide. Whereas we generally talk about leadership and governance on a national level, it is important that this leadership cascade through every level of government, and to make sure that it becomes a leadership that is sensitive to the different challenges in each of those levels. A big role of governance, of course, is to regulate, no? Regulating not only the behavior of the workers, but also the financiers as well as the support services, including pharmaceuticals and diagnostic clinics. It's important then that in the exercise of such power, governance should establish a transparent and accountable system that will make sure resources are rationally used and can be sustained. It's also a big role of leaders to set up partnership both in within the public sphere as well as in the private arena. These alliances should be able to create more opportunities in terms of improving services and minimizing costs. We talk about competence then of our health leaders and non-health leaders as well in understanding the root of the problem. And perhaps as offered at the beginning of this discussion, an understanding of the social determinants will provide the context by which health is understood, accessed, and addressed. And therefore, hopefully, this framework becomes part of an understanding of our national and local government leaders. Of course, the prevalent issue or the long-standing issues on corruption and local politics that seem to affect the creation of public policies that are responsive to the health issues and the challenges thereof. It is important then to discuss these things, to discuss the issues and the challenges without the hindrances of party politics. Moving forward then, leadership and governance must involve in ensuring a strategic policy framework that will be combined with effective oversight, looking at the big picture, coalition building, involving as many, in fact, practically the entire society with all its different representing all its the different sectors, regulation to ensure that there's always quality, safety, and easy accessibility of the services and the products. And then, of course, as mentioned a while ago, a particular attention to system design that will allow us to build a system that would be sensitive to the conditions, the ever-changing conditions at the ground. And lastly, a leadership that is always accountable, not just in terms of the utilization of resources, but in the rationality and the responsibility to the interventions and the outcomes that will happen from there. In terms of big directions, then, it seems that universal health care, as embodied now in the Universal Health Law, could be the direction in coming up with or in helping us improve and therefore make the system more equitable for the rest of society. This universal health care then will ensure that the people will have the access to the full range of promotion, prevention, as well as cure and rehabilitation services that are of sufficient quality and effective without subjecting the users or the general public to financial hardship associated with paying thereof. And so, as we see now, this health system will actually operate in an increasingly complex and changing landscape and must not isolate itself from the rest of the determinants. The health system must, in fact, see the other elements of social and with social and societal characteristics as part of itself, not separate from itself. This would be a more rational and a more strategic approach then to improving opportunities and outcomes. Again, the system should be able to address all dysfunction, and moving forward, we envision a health system that can appropriately assess by monitoring appropriately assess the different conditions and challenges in society with as far as health is concerned. It should be able to provide institutional measures, no, that can create policies that are just and equitable, mobilize community partnerships, which means we should allow more participation from the end users, or in other words, the people as a whole. At the same time, we should create a system that will not only inform and educate, but should empower every single citizen of the land. And then finally, the third general function of our system should provide for assurance that will not only look at the quality of services, but at the same time to make sure that this quality or the gaps and the problems are constantly and regularly evaluated and improved. Now, it is again understandable that to be able to make such changes and reforms, we need to have the data, and that data is provided by research. And then, of course, we need to put them all together in a system that will function smoothly, that will function in an integrated and sustainable way. All right? So I suppose that will sum up our way forward in terms of a system that we envision. Hopefully, this pandemic has made us more realize the need for such an equitable system that will function effectively and efficiently. In the end, we ask ourselves how we all contribute and participate in this system. So the big question of how do we build a more equitable system for the general public? How do we become more responsible for our health? How do we utilize health services rationally and sustainably? For government, how do we integrate the health agenda in public policy in order to support health workers, regulate services, strengthen social protection? And for our health professionals, how do we match compassion with excellent service? How do we expand our role as health professionals in the field or in the arena of national development as well? Hopefully, these discussions are only the beginning of our more in-depth reflections that will help or that will equip us with not only the knowledge, but the inner drive to participate well and to participate in the best way that we can. And that ends our 3-part series on the health system. This has been Dr. Norman Dennis Marquez for Areté's Our Way Forward.